The primary recommendation that I would have for our surgeon colleagues is to be open minded. The biochemistry and the science behind amniotic tissue is very different than most soft tissue grafts that they may have used in the past. It really is more of a bioactive material that is delivering growth factors and cytokines to an area of injury or surgery.
In our group for the clinical applications and surgical applications, we've really seen a huge improvement and a huge need for first MTP joint pathology, so chilectomies and cleanouts of the joint, insertional Achilles and watershed chronic Achilles tendinosis surgeries has been largely our biggest uses for sure. A second kind of tier would be perineal tendons, and this is really a different type of a product that we're using this as a scaffold, as a tissue separator as such, but really as a delivery mechanism for these anti-inflammatory, anti-scarring properties that it has. And so really taking the stance of kind of less is more as far as fixation and suturing and things of that nature, that the graft doesn't have to be rigidly constrained in and around a tendon like we're used to using, to be able to have that on there and then contain it, but not worry about binding it down with a lot of suture.
Amniotic membrane that we have been using currently comes in 2 thicknesses, which allows you to have a variability in your surgical application. There's a thinner 100 micron thickness membrane that seems to have a very good tactile feel. It applies very easily. I don't tend to need sutures with that material, and it's very good to lay on a suture line on a tendon. The other is 1,000 microns thick, a thicker material, more robust, easily applied over hardware and around a more robust tendon like the Achilles tendon. I don't find that suturing needs to be done all the time. If the tissue envelope can be placed over top of the membrane without the membrane moving or shifting, then I tend to use less suture so that I have even less foreign body reaction. The membrane feels slippery in the hands, but it spreads out on other tissue very, very well.